I'm Katie.
I'm Eduardo.
And I'm Elizabeth.
And we'd like to introduce you to our proposed Women's Health Clinic. Our mission here at the clinic is to empower women with education and awareness so that they are transformed from victims into agents of their bodies, with a focus on the early stages of menstruation and pubescence. Through advocacy, outreach, psychiatric aid, and by establishing a healthy relationship with their bodies, we hope to provide women with an understanding and acceptance of their bodies.
At first, we expect the clinic to be organized and run by volunteers and by interns seeking college credit or experience in this field, something like eating disorders, gender studies, grassroots organizations, etc. Initially, the clinic will be funded through payments made by individuals, schools, or organizations on a sliding scale that will be based off of that individual's financials.
Our target demographic would be women from the ages of 8 to 21. Although the average age of menarche in the U.S. is around 12 years old, there are female-bodied youth who begin to menstruate as early as 8 or 9 years old. The goal of the clinic is to provide education and information so that female-bodied youth can be comfortable with the changes they experience. Women usually experience puberty into the late teens to early 20s, so targeting women up to age 21 who might still be going through the final stages of puberty would be an important goal of this clinic.
Knowledge is power. In order to empower women, we want to inform them about their bodies, implementing 2 advocacy and outreach programs designed to combat the stifling taboo on menstruation and lessen the burden of institutionalized secrecy. The most comprehensive of these programs will be our youth outreach program, where we will visit schools and after-school programs to inform children as young as 8 years old about menstruation. Educating children this young will help lessen the trauma of menarche, which many women experience before the age of 10.
As we mentioned earlier in our mission statement, this clinic is purely dedicated to education, awareness, advocacy, and outreach. But we will have information available on our website with links to how an individual can obtain free to low-cost birth control, OBGYN appointments, and doctor-provided health care.
Employees will instruct pubescents and prepubescents on the various methods of managing blood flow, such as tampons, and how to use each one. They will also discuss the health ramifications of beginning menstruation, such as the possibility of pregnancy and anemia, as well as side effects like cramps and how certain medications can control each symptom. These talks will be for all students, regardless of sex or gender, to better fight the taboo on menstruation.
Within the clinic, we will be offering group therapy sessions about body relations and sex and gender identity. The group therapy sessions will be led by the individuals themselves, but we will have a licensed therapist available either via Twitter or text messaging throughout the sessions if the question comes up that someone doesn't know the answer to or would like a medical professional's advice on the specific topic.
Our clinic's advocacy also includes lobbying for a necessity for anyone between menarche and menopause, feminine hygiene products. Some stalls have places to put used pads and tampons, but I have not seen a bathroom that sells fresh ones in more than a decade. In the middle of class, I can't just go to the nearest bathroom. I have to go on an epic journey. First, I have to wait until an elevator comes so that I can get back to the ground floor so I can leave campus. And then I have to go to the nearest drugstore so that I can buy a box of tampons. Without feminine hygiene products available in bathrooms, women are forced to constantly consider the possibility of their periods, to the point that they dread menstruation and feel used by their bodies rather than in control of their lives. We advocate agency over one's body. We will lobby for the availability of tampons in public bathrooms.
Within the clinic will offer a bevy of information about these previously mentioned health aids, as well as provide information on our website about info ranging from toxic shock syndrome to how to insert a tampon. And also within the health clinic, we'll provide a community board where we'll have information that may be of interest to our guests, kind of like this one, but organized. The importance of establishing a physical clinic is so that women and girls will have a place to go where their questions can be answered and their needs met.
Eventually, we hope to turn the clinic into a privately funded organization. Corporations responsible for making products associated with the menstrual cycle, like Tampax, Kotex, OB, Midol, and Always, will provide sponsorship. We feel as though by making this clinic privately funded by a corporation, we could survive the hardships of public funding and would not have to endure the risks of being destroyed.